In 1989, a Croatian researcher called Prad Securic had, after more than a decade, finally isolated a molecule that he called BPC-157. One in that, in his experiments, seemed to heal and protect almost every tissue in the body. But fast forward to today, and BPC-157 is embroiled in controversy. There are plenty of examples of people saying that it works, just like this Joe Rogan clip. And I had a tendonitis in my elbow that I just could not fix. I started using BPC-57. It was gone in 2 weeks. Yeah. And this month it landed in front of the FDA, where an advisory panel voted to make it easier to get overruling the AY's own scientists who said that the evidence just simply isn't there. But if it doesn't work, why did the World Anti-Doping Agency ban it? Well, the answer is quite strange, and it starts with a question that Securic couldn't let go of. Your stomach holds acid strong enough to strip the meat off the bone, yet it doesn't digest itself. Something is protecting it. But what? Well, in 1975, Securic, who was then a second-year medical student at the University of Zagreb in Croatia, then one of the republics of Yugoslavia, he became fixated on that stomach puzzle. He reached a conclusion that nobody at the time was teaching him. The stomach must make its own protective healing substance, some natural compound that keeps it from eating itself alive. He half-jokingly gives the thing that he's hunting a name, substance, God help me. Finding it took Securic more than a decade, collecting gastric juice, chasing substances that no one even was sure existed. One stubborn idea against years of nothing. Now, quick note before we go further. If you're new here, I'm Brad Stanfield. I'm a family medicine doctor, and on this channel, my mission is to give you the science and practical tools to live longer and feel better. But even though I'm a physician, I'm not your physician. So please talk with your own doctor before making any changes to your health, because this video is educational only and not medical advice. In 1989, after more than a decade of searching, Securic had finally cracked it. He'd found the molecule that he thought protected the stomach, and his team's first paper lands in 1992. Now what he then did is took a small piece, a fragment of that much larger protein, and called it BPC-157. So it's just the first 15 building blocks of that bigger protein. So 15 amino acids in a row, a peptide. Now BPC, by the way, stands for body protection compound. But then comes the part that makes the story so strange. They then took that tiny fragment and then they started testing it on everything. They tested it in rats where they triggered stomach ulcers in 3 different ways with stress, with a particular chemical, and then with almost pure alcohol. So 3 separate ways of wrecking a stomach lining, and BPC-157 protected it against all 3 of these types of damage. Then they tested it in tendons. Now, tendons are notoriously slow to heal because they've got barely any blood supply. So it was a big deal when they cut a rat's Achilles tendon. It cleaned through, and then they gave it BPC-57. Now, the tendon didn't just improve, right? The researchers described it as a full recovery. Then they turned their attention to skin wounds, then muscle, then bone, then nerves, and then they started working out how it might be doing all of this. So at first it seemed to calm down inflammation. So in one Remedies study, they first irritated the animal's nose with capsaicin. So that's a compound that makes chili peppers hot. And BPC-57, it blunted that reaction. The more they gave, the bigger the effect. Second, it grew new blood vessels, so it seemed to switch on a growth signal called VEGF, and new blood vessels formed. So more blood supply, faster healing. It also seemed to act through nitric oxide, which helps to control blood flow. So overall, for every injury that they could think of, BPC-57 seemed to protect and heal almost all of it. And Securex's group were so struck by it that they proposed that it might be the first of an entirely new class of medicines called organoprotective agents. Now, a compound that heals almost anything is one of two things. It's either a genuine breakthrough or it's a warning sign. And there's one more early finding that I'll circle back to later in this video because it is an odd one. Securex's own lab in 1997 also reported that BPC-157 did something in the brain. It blunted the effects of amphetamine. Now, I'm going to circle back to that. For a while, all of this research made it look like BPC-57 might actually become a real medicine because a real drug company thought so too. In 1993, a Croatian pharmaceutical company called Ply licensed it, and they ran a human trial. So remember the original BPC-57 research, it was looking at the gut. So PLA ran a human randomized double-blind placebo-controlled trial on a bowel disease called ulcerative colitis. They gave BPC-157 as an enema. Now that trial finished 20 years ago, and at the time the results were not published. So for 2 decades, nobody outside the company could see how that trial turned out until this month. Because when the FDA finally sat down to review the evidence for BPC-157, they put the real numbers into a public document. So this trial involved 53 patients. BPC-157 again was given as an enema against a placebo. And this was done over a 2 period. And the difference between the two groups came out at 1.6 points on a disease activity score with a confidence interval that crossed 0, which is a statistical way of saying that this could have easily been nothing at all, as in the results were inconclusive. Then skipping ahead to 2006, the pharmaceutical giant GSK, they bought Pliver's research arm. The BPC-57 program, unfortunately, it was quietly dropped, and the rights to BPC-157, they drifted back to the original researcher Securec, and the compound fell out of the pharmaceutical world entirely, never to return. And here's why. Patents last about 20 years, and the patent that covered the molecule was filed all the way back in 1990, which means that by 2011, it expired. Now, once something is out in the open, that door is closed forever. Nobody can own it. So that means that the general public can get their hands on it from gray market labs. But it also means that no company will ever be able to get their money back if they ran a big, expensive human trial, because the moment that they proved that BPC-57 worked, every gray market lab would start to sell the exact same molecule at a fraction of the price, having spent nothing. So the trials just stopped, not because of a conspiracy, but because of simple arithmetic. Now, to date, there's only one published human clinical study on BPC-57. It's a look-back survey-type study of 16 people who had had BPC-57 injected into a painful knee. So there was no control group, no placebo. They were just asked months later whether they felt any better after the injection. And knees get better on their own all the time. So this study, unfortunately, it tells us almost nothing. The only other human study that I could find was back in 2015, but by 2016, the researchers had canceled the submission of the results. So we don't know what had happened there. So that's the science of BPC-57. It has stalled out. But out in the real world, something completely different is happening. So bodybuilders and biohackers, they dug up those old rat tendon studies and they started injecting BPC-157 into their own shoulders and knees. So a drug that was originally built for the gut had become a tendon injection. So here's what the FDA said about that this month. They went on to look for human studies of BPC-57 given by injection or by mouth or by a nasal spray or through the skin. Every route that people actually use, they found no human studies related to tendon recovery. To be fair to this idea, remember that from the original animal work, BPC-57 appeared to grow new blood vessels. So in theory, more blood supply equals faster healing, which might be great news for tendons, which don't have a great blood supply. But growing new blood vessels is also exactly what a tumor needs in order to grow. So the honest position is this. No one has shown that BPC-57 causes cancer, but equally, nobody has shown that BPC-57 doesn't cause cancer. Right? Nobody has run the experiment. Now, Securec says that the risk in, and again, I'm taking him at his word here, is entirely excluded. And he says that based on a single cell study from back in 2004. That statement has drawn a lot of criticism because other researchers have rightly pointed out that we lack that human safety data over a prolonged period. And now I want to circle back to that 1997 finding that I told you to remember earlier, the one where BPC-157 blunted amphetamine responses. And this was from Securic's own lab. Well, people online are now reporting that BPC-157 flattens their mood and dulls their stimulant medication. Now, this comes from a data mining project on Reddit. So, do take this with a massive pinch of salt. It's aggregated anecdotes. It's not published evidence, but it's anecdotes pointing straight at something that his own lab published nearly 30 years ago. And here's the deepest knowledge gap that we have of all, and it takes us right back to Securic himself. Now, remember that larger protein that he found that was meant to protect the stomach lining, the one that BPC-157 is supposedly just a piece of? Well, in more than 30 years, he has never published that original molecule's full sequence. When independent researchers went hunting for the gene that would build it in the human genome in our gut bacteria, they just can't find it. Anna Mapp, who's a chemist at the University of Michigan and the president of the American Peptide Society, reviewed his work and put it bluntly. There was never any real proof that what he isolated was a single pure substance at all. So why wouldn't he release it? Well, his answer, when a reporter asked him about this, tells you a lot about the man himself at the center of all of this. So he says, if you have your own child, you want it to be yours forever. But that's not the only blank. There are still big ones. So not only do we not have the original full sequence of that original stomach molecule that gave rise to BPC-7, nobody has ever found the receptor that BPC-157 is supposedly actually to work through. Plus, it clears out in your blood under 30 minutes. Yet people claim that its effects last days. There's no pharmaceutical grade version of it anywhere in the world, and nothing to make a real medical standard against. Which brings us to this month, because BPC-157, like I mentioned before, went in front of the FDA advisory panel. And you may have seen the headlines saying that FDA have approved it, they have not. What actually happened is narrower and stranger. A panel of outside advisors voted to recommend that pharmacies be allowed to compound it. The recommendation is non-binding. The FDA hasn't agreed to it. No rule has been written. Nothing has changed. And the actual rule is likely a year or more away. Now, here's the part that matters the most, because the FDA's own scientists have already reviewed all of this data, and they recommend against it because of a lack of evidence. And listen to the problem that one FDA official laid out at that meeting. BPC-157 isn't a recognized pharmaceutical ingredient in the United States. There is no legal definition of what it actually is, which means two vials of the very same name on the label can contain different things. So the agency can't even write a quality standard for it because they can't say what it is. The panel voted anyway, though, and the only condition that they were even considering it for was ulcerative colitis. That was the original human study that was done all the way back in the 2000s. It was done for the gut. So it was not done for tendons. It wasn't done for injuries. It wasn't done for the reason that most people are actually buying it for. The regulators are still looking exactly where Securic pointed 50 years ago. Meanwhile, everyone else is injecting it into a shoulder or into an elbow or into a tendon, which takes us all the way back to where we started in that ban. So, if there's almost no human evidence, why did the World Anti-Doping Agency ban it? Here's the answer. They didn't ban it because it works. They put it on a list called S0, non-approved substances. It's the category for things that no human health authority anywhere in the world has approved for use in humans. So, the ban was never proof that it works. Okay? It's the opposite. It's an official statement that nobody knows what it does. Much like the FDA's official position, the research just hasn't been done. And the compounding list that the panel just voted for, well, by law, that list exists specifically for substances that aren't approved. Getting onto it isn't an approval. It's just a formal acknowledgement that you've never got one. So that's the whole story from start to finish. It started with a stubborn idea from 1975, a young researcher who spent his life on it, a compound that appeared to heal almost anything in his experiments, and these experiments were done in rats. We do have a real human clinical trial on it whose results nobody saw for 20 years. And finally, we do have those results. We have a molecule that no company can own. So no company will ever finish testing it. and a stack of the most basic pharmacological questions. Is it safe? At what dose? Made by whom? And how exactly does it work? That still today we do not have answers for. So the honest bottom line is simply that the evidence just isn't there. Not that it's been disproven, okay? It's just that it's been never properly tested in people at all in terms of human clinical trials. So what you choose to do with that is completely up to you. I'm not here to tell you what to do. And look, if you do want to see what this looks like when trials do get done, when a peptide actually gets tested properly in tens of thousands of people with real results, I made a whole video on it exactly here. It's a very different story, and you can watch it. I've also put the full write-up and the transcript of every study that I've cited over at darstenfield.com. Link is in the pinned comment. And if you want bonus videos from me, plus early access to videos like this one and priority replies in the comment section, you can join as a channel member or over on Patreon. Links are both below.